Hey everybody, it's Dr. Eric Balcavs. We're back for another edition of the Thyroid Answers Podcast. And this is the Q&A episode. I don't even remember what number this is, but Jen Quintana is back to continue this series of Q&A that she's come up with her base of people that follow her and her podcast. And it's great because these are all the same questions that almost everybody has. So we'll get some more questions answered. Jen, Tara, how are you today?
I'm good. I'm like, who's Jen?
Been a day. It's been a day.
It's one of those days. I am doing wonderful, Eric. It's beautiful out right now. It was questionable earlier.
Yeah. So I don't even know what it's like. I'm stuck in this little inner office space with no windows, but from what I've heard, it's still hot and humid here in PA. So, all right. But let's get into it. Let's talk Q&A. One of my favorite parts of the week.
Okay, the first one today. How important is liver health in managing thyroid conditions, and what can I do to support liver function?
Well, I'd say liver function is really important, and liver function impacts thyroid physiology, but thyroid hormone plays a massive role in thyroid function, and thyroid hormone plays a massive role in liver function and liver physiology. So, what can you do to improve liver physiology? Is that what the question was?
Yeah, what can I do to support liver function?
I'd say the easiest thing that almost anybody can do to improve liver function is the foundational things we talk about on almost every one of these things, right? We need to eat a healthy, whole food-based diet, low processed food diet. When we consume a lot of processed franken foods, the chemicals that we consume definitely have an impact on liver function, biliary function, bile production, bile flow, and it can be a significant issue. So reduce your processed foods, eat more whole food, and that's one of the best things you can do. 2, be well hydrated. I think that's one of those key things that becomes really important because, especially more directly related to biliary function, but bile is produced in the liver, but 90% of bile is water. So if 90% of bile is water and you're dehydrated, it's going to have an impact on biliary function. It's going to have an impact on bile flow, bile congestion. God bless you. So those things are important. Proper sleep, proper rest, proper exercise. So the diet and lifestyle things becomes really important. Now, the other thing that we talk about is reduce the toxic burden on your physiology, right? So less toxic products, food products, cooking products, personal care products, home cleaning products. It's hard to escape toxins, and the liver is designed to deal with these things. But just having less of a load on the system is great. And then I would say the other thing, even though it's a big part of a lot of people's social life, is alcohol. Alcohol is a toxin. Alcohol puts a lot of stress on the system. And if you are consuming a bunch of alcohol, it's going to have an impact on your liver function and liver physiology in time. It doesn't mean you can't have some cocktails, but if your habit is to drink alcohol versus your behavior is to have alcohol, it's going to be a difference. And what I mean by that is if you're closing out every day with 1 or 2 glasses of wine or a couple of drinks just to unwind, that's a habit. And that's constant stress on the liver versus, hey, I have a couple of drinks on the weekend with my friends, or I have a cocktail periodically. I think it is not the best thing for your liver, but I think there's something to be said about being amongst friends, having a drink, eating, and having a good social experience where you feel happier and you engage and it creates more joy in your life. I think that's good. Are there supplementation strategies that we could use? Absolutely. But I don't like to get into those things because I think the most important things that we can have people do is not just start with a bunch of supplements, but clean up their diet and their lifestyle. And I think those are the most important things. And then the last thing I'll say on that is, don't overload your system with supplements, hormones in an effort to try and optimize your health. It's probably one of the biggest things that is up my crawl at this point is this term of optimization. We're going to optimize your thyroid numbers. We're going to optimize your sex hormone numbers with medications. And we're taking things that we think are optimizing the person. Really what they're optimizing is a blood value potentially, and the side effect of loading more thyroid hormone or more excessive thyroid hormone or sex hormones into a system that can't manage them is problematic.
Yeah, that was very well said. I feel like you and I are definitely in agreement with starting with the fundamentals, the basics. And I feel like so many individuals want, I mean, who wouldn't want the quick fix, right? Except the quick fix doesn't fix anything. It's a Band-Aid and underlying issues are still there. And when I think about the liver, I'm thinking about, the essential part of the way in which we detoxify the body. So every single thing we're coming in contact with matters. From, like you said, our exposure to toxins, and I'm going to say our thoughts, like our beliefs, the things that we are continually saying to ourselves or about our life, that it matters. And thinking about the nervous system and the role that obviously we have one body, so we have all these amazing things going on, but it all matters. So if somebody were like, obviously they asked this question, and I know people want to know, like, what is that one magical supplement? But if you shove a supplement into a system that is already, stressed out with overload of so many different things, I think and believe that it's going to have a worse impact than not taking the supplement at all. And I feel like that's really controversial, especially in the functional medicine space, because I don't have to tell you, because there's literally programs out there for functional medicine practitioners to go and do a weekend course to learn all the protocols for the supplements to give people. And that is, in my opinion, such a disservice, not only to the community, to people, but to the practitioners, because it's not really focusing on the most important part, which is looking at the reason why the body is having issues to begin with, and ways of, clearing out the terrain before we start shoving a whole bunch of stuff inside there. So yeah, I absolutely agree.
Yeah, it's funny, and because I had this conversation earlier today with somebody, and they're like, there was somebody who we did an initial consult, and they're working with a couple other practitioners. So I typically don't get involved when there's multiple practitioners involved. I think it's just too messy. But her message to me was, I was hoping you were just going to tell me how to support my detoxification pathways with all the things I'm doing. I'm like, if you want more supplements, how about you just eat a healthy diet, right? If you eat a healthy diet, all those micronutrients that you're looking for are in the foods you eat. Get some organ meats, eat some of those plant-based foods, eat some sprouts, broccoli sprouts have loaded with sulforaphane, which is probably one of the most potent upregulators of the NRF2 system. And for the listener, what does that mean? NRF2 is the master antioxidant, detoxifying, and anti-inflammatory gene in the body. So when we upregulate that NRF2 gene, it turns on 200 different enzymes that support anti-inflammatory, antioxidant, detoxification pathways. And sulforaphane from broccoli sprouts, super potent. Within 15 minutes, it's hitting the brain, and it is hard to become overloaded. So you're not going to have a lot of negative side effects from it, because it only lasts in the body for 24 hours. And it's natural. It's a natural product, right? You just eat, right? So most of the stuff that we need to support healthy liver, gallbladder, and detoxification pathways are already in healthy foods that so we don't have to do like, I'm going to do Jane Doe's or Joe Doe's detox 30-day detox protocol. How about you just eat healthier foods, exercise, sweat, get to sleep, get plenty of rest, reduce your emotional burden and stress, get out in nature, like just do the foundational things before you jump to a whole bunch of supplements to try and manipulate something.
I've got to say, I absolutely love that you said sprouts, because I'm not even kidding. In treatment plans, I have that as like a dot phrase, right? Because I use it so much. Like, I created this for microgreens. First, I grow them. My closet in my office is filled with different varieties of, and I love it because these plants, a lot of them are bitter. So then that's a whole other awesome thing that you're getting just to help the body. Like, if we're talking about the beginning stages of digestion, just to help to get things going. It's so important. And they're so easy to bring in to the diet. I literally have, I don't even know how many people, like over 100 people that don't like vegetables that are growing their own microgreens. Now, you don't have to grow them, but they're so easy. If I can do it, anybody can do it, because I really do not have a green thumb, and it's inexpensive. But even if you buy them at the grocery store or at the farmer's market, they're so easy to throw into things. And like, I throw them in a smoothie because it's just an easy way to do it. And then I know, like you said, it's really hard to like overdo it, and it is doing amazing things for the body. I don't think anyone that I've put on a microgreen diet hasn't noticed a tremendous impact. And it's usually right away, like saying, I can't believe the energy that I have, versus, can I take another supplement? I don't know, maybe, but it's got to do something in there versus coming straight from food. And then, so you're getting all of the different nutrients, and it's, and you could check the box for vegetables also, which is just an amazing thing.
Yeah, I think we should just add, because somebody might be hearing us talk about like sprouts, and especially from a broccoli sprout perspective, like, well, I eat broccoli, but the sulforaphane content in this 3 to 5 day old sprout is 100 times greater than the mature broccoli plant that you're eating, that probably you're buying at the store doesn't have much flavor or taste to it to begin with, because it doesn't have as much nutrients. The broccoli that I grow in my garden tastes totally different from the broccoli that you buy at the grocery store. But even though you would think the mature plant's going to have more micronutrients in it, it's the potency of the sulforaphane in those sprouts is night and day different. And a bag of organic broccoli sprouts, broccoli seeds, right, is the cost of about one bottle of high grade sulforaphane. And I've worked with a company to make sulforaphane, so that's important to know. But you could buy a $30 bag of broccoli seeds. It would probably last the average person easy a year, if you're, depending on how much you're eating. And that's like half the cost of a bottle that's going to probably last you a month to 2 months tops, right? That's because it costs money to process and make the stuff, but it comes in nature. I will say this one other point is that I do think you can pick up sprouts at the store, but for the person who's new to this, eating the sprouts is great. There's lots of value in them, but especially broccoli sprouts, they're very delicate. And so once those sprouts start breaking down, you've already lost the sulforaphane potential. So when you crunch on the sprout and you kind of break the plant in your mouth, or the plant's breaking down just because it's starting to get old, there's chemicals in there that come together to produce the sulforaphane. And so I think it's buying at the store is good. Throwing them at home in your mason jar or in your little tray or whatever is probably the best, because you can they're fresh, and you know that they've had the highest content. But if you can't do it or you don't want to do it, it's so simple. Buying at the store is the next best for sure.
It's very satisfying to grow them though, and they grow really fast.
Yeah, we're talking
And
3 to 5 days. I mean,
yeah, and definitely broccoli. I love radish also because it's so bitter and you don't even notice that it's in a smoothie, except it gives it so much flavor. And then, of course, a huge benefit from eating the plant are all of the phytochemicals aside from the sulforaphane that you're getting versus just taking a supplement. So yeah, that's definitely a great route for the listener to. It's an easy thing to add in, and this is coming from Dorito Girl.
Yeah,
I think we talked about that before. Sweetheart and Dorito Girl. Now I'm eating all of these plants every day, but it's so easy, especially in this form, and really inexpensive, which matters because things can get really pricey, especially with supplements.
Absolutely. All right, let's hit the next one.
Okay. How does the functional medicine perspective view the relationship between chronic fatigue syndrome and thyroid health?
How does the functional medicine community regard chronic fatigues? Differentiate, or?
It just says the relationship between chronic fatigue syndrome and thyroid health.
Okay. So chronic fatigue syndrome is just something we made up to express some symptoms, right? And we do this with diagnoses all the time because we need diagnoses to kind of give somebody something to hang their hat on as to what's wrong with them. Chronic fatigue syndrome explains your symptoms. It's not a diagnosis of what's wrong with you, okay? So anybody who has chronic tiredness, chronic fatigue, has that label, typically has a couple of things going on. There's a level of chronic inflammation going on. There's reduced mitochondrial energy production, and they're potentially having challenges regulating energy production, blood sugar regulation, adrenal physiology to some degree, but it's kind of a long-winded thing to get into. But does thyroid hormone play a role in somebody potentially having a chronic fatigue syndrome? And I would say yes, because the person who has a chronic fatigue issue going on isn't making energy efficiently. What do you need to generate energy efficiently? You need appropriate levels of T3 inside the cell to support mitochondrial function. You need appropriate levels of T3 to burn fats as a fuel efficiently, aerobically. You need sufficient levels of T3 to transport glucose into a cell to convert into energy. So if there's inflammatory mechanisms, there's going to be a natural downregulation of metabolism, natural downregulation of energy production, and there's going to be a natural decreased conversion of T4 to T3 inside cells. That's going to ultimately result in some decreased production of circulating T3, which is going to have an impact on a lot of different systems and tissues. So I would say almost anybody who's struggling with chronic fatigue issues has likely some level of thyroid. And I'm going to use a term that sounds more medical, but has a level of thyroid allostasis, meaning that cells exist and regulate themselves under one of two modes, either in low stress mode, which is what we call homeostasis, or high stress mode, we call allostatic regulation. So anybody who has a level of inflammation, stress, has this kind of fatigue, I'm so tired, I can't barely get through the day thing going on, you're not making energy efficiently. And that's usually secondary to this some type of cell stress, inflammatory mechanism that's downregulating thyroid hormone conversion inside the cells and tissues. And so those two things are intimately related. Okay. But even though I just said that, that doesn't mean, oh, if you're saying that there's a reduced T4 to T3 conversion, therefore I need to give T3. That's not what I'm saying. What I'm saying is you need to address the root issue. What you're experiencing is not thyroid dysfunction, at least at the onset. It's thyroid allostasis, which means the body is saying, hey, We need to change the way we're regulating thyroid hormone because of what's going on with the cell. Not that the physiology forgot how to convert T4 to T3. These are cells or tissues that are adaptively decreasing it. So we wouldn't want to put more thyroid hormone into a system that didn't want or wasn't doing the conversion to begin with. Yes, it would change the value, but it doesn't improve function long term and actually potentially creates more problems. What are your thoughts?
Well, first, I think you said a couple of really, really important things there. I mean, the first being,
well, thank goodness, right?
Well, usually you say really profound things, but this whole concept of chronic fatigue, I've had, let's see, 4 people in the past couple days, come to me and say, they have this diagnosis and it matters. And it's because of this diagnosis that they have all these issues. And like I'm saying, well, it's a diagnosis of symptoms. Like I don't want to say it doesn't mean anything, but we get so tied to the diagnosis that I'm kind of the mindset of that where the label itself is not what matters. It's the dysfunction of the body. It's whatever is happening at the cellular level. That's what I really care about. Now, I care if it's bothering somebody and they really want to know what's going on. But when we get a diagnosis like that, it's not really telling us anything about what's going on. So we have these symptoms, this fatigue, and then the answer is some type of a medication, right? So if we blame it on thyroid, right? So obviously thyroid is going to play a major role in metabolism and fatigue and the way that we feel. But I 100% agree that the answer is likely, I'm going to leave that as a caveat because maybe in somebody it is, but for the majority of people isn't just to shove T3 in. Because I think that there's more and more evidence all the time coming up about this. And I know you talk about this a lot and it fires me up because I want to spread this message also because it really matters that what is happening when we do that? Is it benign to just shove this hormone in if there's some underlying thing going on that the body is putting the brakes on? And I don't believe we can bypass our really intelligent system by just targeting this hormone or this hormone, especially when we're thinking about a system that is brilliant, right? And we're designed to survive and to thrive. So if we have this chronic fatigue, I want to know what's been going on. Like, why do we have these issues to begin with? Or if we have mitochondrial dysfunction, what are we doing? What kind of lifestyle? Frankly, everything is going to circle back to that. Like, we can't escape it, which is wonderful because in my opinion, that's like one of the best things, like places to look because one, it's free and it's easy, but it isn't. So I think last time or one of the other times I said it's hard, but it is easy. It just might seem like more difficult to do. And it's so much easier just to take medication. So, for this question, how like the functional medicine perspective view it, that's a loaded question. Because I think it depends on who you're asking. Because I think a lot of practitioners are on board with more and more of whatever, if it's a hormone or a supplement, till somebody says that they feel better. But I do think that the feeling of like I feel better is going to be temporary. At least that's what I've seen in my experience. And I'm all for, I want people to feel better. And depending on all the circumstances, that might be a rabbit hole that I would consider jumping in, but I don't think it's as simple as take this for this, if that makes sense.
Yeah. I think the big thing comes down to when we're thinking about thyroid physiology and how does it relate and functional medicine in general. I think you hit the nail on the head. It really depends. There are people who I think are really doing a good job practicing functional medicine. There are people who are really focused on just optimizing blood levels of things and assuming that that means improved cellular physiology. And I think that's a problem. But I do think there's a portion of people who are trying to do what you're talking about. Like, okay, I'm just going to give them a little bit to make them feel a little bit better while I fix the other stuff. And I think that's not necessarily a bad strategy, except for the fact that in many situations, I think it becomes the default strategy. Oh, I got that. You gave me some and I felt a little bit better, but now it's not working. Okay, well, I'm sure it's not a big deal. We'll just give you a little bit more. And now you're in the trap. And so now we're taking more T3 and now that's suppressing TSH. And now I don't have enough T4. And so now I start to feel bad again. And now that you've got into this cycle where A, you're not really addressing the issue, the real issue, and B, now you're preventing that thyroid gland. If part of the goal is to restore thyroid gland function along with peripheral conversion, adding too much thyroid hormone to a system is not going to be beneficial. Because if we think about what TSH is doing, if we suppress it with medication, T4, T3 combination, if I have less TSH, I can't turn on the sodium iodide symporter to pull iodine into the system. We can see that as TSH goes up, we get better peripheral conversion of T4 to T3. So if I take more T3 and I saturate the pituitary and I drop thyroid gland production, now I've lost T4, right? I've suppressed TSH, I've lost some of that T4, and then I've lost, not only that, I have less T4 to convert to T3, and I lose the TSH drive to convert more T4 to T3. Right? So TSH plays a bigger role here than just it helps make more thyroid hormone. I'm going to give you plenty, therefore who cares about it? TSH plays plays a signaling role in a lot of other tissues and systems, skin, bone. We talk about the conversion, peripheral conversion. So there's a lot of influences, even lipid physiology at the liver. There's TSH plays a role. So I get it. I just think it's a slippery slope where we start to give some support and then it rolls into more and more and more. And now the problem is the medication. And I have a patient, person who wanted some help, and she's way over medicated, and she wants to know, she wants help with her gut physiology. She wants help with her anxiety. She wants help with her histamine issues and her mast cell issues. I'm like, the number one thing we need to do, if I'm going to help you, you're over medicated. You want me to fix? You don't want to touch the thyroid hormone because you're worried about gaining weight. So you've become over medicated on T4 and T3 to create a hyper sympathetic state to be able to maintain your weight, like you're essentially create a hyperthyroid state, which is allowing you to maintain a weight. And if you're not taking this excessive load, then you start to gain weight again. You don't want that to happen. Okay. But that excessive thyroid hormone to maintain this weight that you want is the reason that you have a histamine issue, an anxiety issue, an insomnia issue, and all these other issues. So you want me to do what? How am I supposed to fix those things if you're the excessive medication is part of the problem? And I'm like, well, give me, you can fix my gut. How am I going to fix your gut if you're in a hyperthyroid state and in a hypersympathetic overdrive? How am I supposed to help you fix your gut? You're not in a healing state. You're in a fight or flight state. Mm-hmm. I want you to give me something to support my sleep. How am I going to help you support your sleep? You're oversaturating your brain with thyroid hormone. You're upregulating your sympathetic nervous system. You want me to give you more supplements to try and suppress symptoms? And I understand what she wants. She does not want to feel bad in the process, worse. right? I don't want to feel, I want to keep my weight and I don't want to feel bad, but I want you to fix me. It's not going to happen. That's like saying, hey, I want to build big, strong muscles, or I want to be able to train. I want to be able to run a marathon, but I don't want to go through any of the stress on my body of actually training and having sore muscles or anything like that. So I want you to get me fit for that marathon or get me ready for that strength competition, but I want to feel fantastic every day. Well, that ain't going to happen, right? Because
No.
the process of getting bigger, of healing, of getting stronger, there's some ups and downs in the process. And it's the same thing with healing. But I think I got us way off track. So
Yeah, well, I like the track that you went down though. And to add one thing to that, I would argue with anyone who would like to, that when we're in that sympathetic state, that's a driver of us having weight issues. And it is going to impact lots of other hormones in the body. I do not believe, and this is, people might come after me for this, that, okay, let me rephrase that because I don't want to just say it like that, that thyroid medicine should not be given for weight. That I don't like, that is not a weight loss strategy by itself. Okay. Like I'm gaining weight and so give me thyroid hormone as a weight loss drug. That's not the purpose of it. If somebody truly has thyroid physiology that's out of whack and they're already on so much hormone, I agree. And if I can't go back in time, I can't put my thyroid back, right? If I'd have known then what I know now, I do believe I would be on it. Like I might still have a thyroid. I would have moved like heaven and earth to do everything possible to get my own gland to work better and so that I wouldn't have to live without it. So I feel like it's somewhat playing with fire when we're shoving something in or like afraid I don't want to come off it, but I have all of these other issues, like you said, for your client. And I get it. I hear that all the time. And I was one of the same patients. Like I have all of these problems. Like what do I do? But it's bigger than that. But I think that's like amazing because then like we can work on like the foundational things and it does like, I'm going to use the word miracles throughout the entire body. So it isn't like just targeting the thyroid or just targeting the gut or mood or anything like that. It's going to have an impact system wide.
yeah. Yeah. It is. I think it's so important for everybody to realize that all these systems are interrelated. And the challenge in the slippery slope is that this is like any other drug. Once you get a taste of feeling a little bit better, you want more, you want more, you want more. You haven't fixed the issue, but it's the same reason why the alcoholic doesn't want to give up alcohol. I don't want to feel terrible. I don't want to go through the cravings. I don't want to go through the crash. It's the person who doesn't want to go quit their drug of choice because I don't want to feel bad, and they still have to deal with the consequences of what got them there. So I think if somebody needs thyroid hormone, absolutely they need some. But what our goal in functional medicine shouldn't be to optimize their thyroid physiology by manipulating T4 and T3 in the blood with medication. It should be by optimizing, if we're going to use that term optimization, the way we optimize thyroid physiology is by identifying what's causing the gland to not produce enough thyroid hormone. So is that driven by the immune system? If that's the case, we need to figure out what's driving that immune inflammatory process. Or two, is it a deficiency of the primary driver of hormone production, which is iodine, which is what nobody checks. So that's how we optimize it. And the other piece is, how do we optimize the peripheral conversion? We don't optimize peripheral conversion by giving T3. We optimize peripheral conversion by making sure we have enough T4 in the system that a healthy gland should be making. Maybe in a situation like you, where you don't have a thyroid gland, the appropriate level of T3 for somebody who in homeostasis would have their gland making a certain level of T3, because the thyroid gland makes some T3, but most of it's made peripherally. So in certain situations, your thyroid gland's really degraded, you might want to support the recovery or support the replacement of what a healthy gland would have made. But we also have to keep in consideration the person who's typically showing up on your doorstep, my doorstep, they're not in homeostasis. So I shouldn't expect their T3 levels to be in an optimal range because they're not in an optimal range. If they had no stress, felt great, all these things, then yeah, we might want T3 to be higher, depending on their age and time of year and all these other things. But their body is already optimizing their T3 for the state they're in. Now, if they didn't have any T4 and T3 is low, I agree. Give them enough T4 to help with that conversion. They shouldn't need 15, 20, 25, 30, 35, 40, 45, 50 micrograms of T3. That's not optimization. That is manipulation. And that's not how we restore or optimize thyroid physiology. Let's hit the next one because we can talk all day on this one.
Yes, absolutely. This is related. Well, they're all related, but how can I address persistent inflammation that might be affecting my thyroid function, but not showing up in standard thyroid tests?
Well, thyroid tests aren't specific inflammatory tests, right? So if you want to know if you have an inflammatory process going on, let's start with what blood work could we look at to look for inflammation. There's high sensitivity CRP, which is a better marker than regular CRP. There's homocysteine, there's fibrinogen, there's ferritin, there's uric acid, there's bilirubin and a low bilirubin in this case. You can look at the iron panel for anemia of inflammation panel. So you look at the iron panel, it's low, iron saturation's low, but ferritin's typically higher. You might see an anemia pattern in the red blood cells. You can look at alkaline phosphatase, too high, too low. You can look at, so there's a bunch of them, right? So there's a bunch of inflammatory markers. But most people say, my doctor said there's no inflammation, but when you look at their test, there's no inflammatory markers. So you have to run them to see what's going on. And these are things that are on a standard. You don't need any specialized cytokine panel to look. These are like standard tests that you can get at any lab. The other thing to consider is looking at the thyroid panel, and you say, well, my thyroid panel doesn't show it. Well, your thyroid panel may show it, but you may not know how to interpret, or your doctor may not know how to interpret those labs for inflammation. So what on a thyroid panel might indicate that there's an inflammatory process going on? If somebody has a normal or low TSH with signs and symptoms of hypothyroidism, that's a good indication that there's potentially some inflammatory stuff going on, because inflammation will increase hypothalamic conversion of T4 to T3. That'll saturate the receptors. That'll lower TRH. And so there'll be a lower TSH. So you can look at that. And especially if the TSH is low or normal or low, and T4 and T3 are low, and especially reverse T3 low. So, hey, the inflammation is suppressing TSH, and it's resulting in a low T4, a lower T3, and a low reverse T3. If you see low T4, lower T4, lower T3, and low reverse T3, then the inflammation is suppressing the gland. The other thing we might look for on a panel is, do I have a normalish T4 or free T4 and a lower-ish T3, free T3, and a higher-ish reverse T3? And so if we see just those, we might go, okay, the deactivated form is higher, the primary hormone, active hormone, is lower. What's the body favoring? And that's going to be the deactivated form. If it's favoring the deactivated form, inflammation is what upregulates deiodinase 3, which is the primary thing that's going to take T4 and convert it to reverse T3, and T3 and convert it to T2. The other thing we might look at on the panel is the free T3 to free T4 ratio. And if that's suppressed, it's a good indication that there's probably some type of inflammatory mechanism that's reducing the conversion of T4 to T3. But you have to see that pattern. And all of the values could be in the normal range. But if that free T3 to free T4 level is reduced, even if everything else is in the normal range, somebody's optimal range, somebody's normal range, if you have signs and symptoms of hypothyroidism, everything's normal, but that ratio is low, there's a good indication there's some type of inflammatory mechanism. So those would be the things I would look at first. If I saw or thought there was an inflammatory thing, then I'd go look at all those inflammatory markers. And then the next thing I would do would be looking at the rest of the blood panel for confirmation of inflammatory driven reduced metabolism. So I would look at the lipids. Is cholesterol elevated, LDL elevated, and where's HDL? Is it too high or too low? Too high is also a big thing. Most people think that's a good sign. The higher is better. But keep in mind, to support a lot of the tissues, HDL needs to dock to the tissue and release the cholesterol so you can make sex hormones, so you can make cortisol, so you can make progesterone, so you can do things. So that HDL receptor needs T3, and adrenal gland's a great example of this. We talked about this before. Somebody says, I have adrenal fatigue. You don't have adrenal fatigue. You're not bringing cholesterol out of the bloodstream to make it. Okay, whether you think that's broken physiology or it's adaptive physiology is a different discussion, but that has to occur. Then you can look at blood glucose. Hey, your glucose is higher, your insulin's higher, or your glucose is normal, but your insulin's high. That's typically driven by inflammatory mechanisms. So we start to look at if there is inflammatory mechanisms, how would it impact the rest of the chemistry? Problem is, for a lot of people, they don't interpret labs. They just read them for high or low. Medical physicians,
Yes.
That happens a lot where their front desk is maybe saying everything's normal and telling the doctor, they may not even really looked at it, but their front desk staff who does their charting and looks at the labs is, nurse practitioner, whatever, they may say, or assistant, they may say everything's normal. There's no H's, there's no L's. The doctor says everything's good. So he's not really interpreting, he's just getting a reading. Is it outside a range that I need to provide some type of treatment? And if you run limited tests and you're only looking for H or L, you may or may not be treating appropriately. But even in functional medicine, we need to do a better job interpreting. There's many times that somebody has reached out to me and said, all my labs are normal. They said there's nothing wrong or everything's optimized and they don't know why I'm not feeling good. And I'm like, well, your labs are in a normal range, but it's totally inappropriate. And here's why you feel lousy. These things are this. I can look at these other factors here and tell you there's an inflammatory mechanism going on. So that's interpretation, but that's not done by a lot of people, in my opinion. I just don't think that's done well. Because if it was, I wouldn't probably have as many people coming to me and saying, nobody knows what to do. And then you look at the lab and you're like, well, what did you do about this? What did you do about that? What was the discussion with these problems? Well, they didn't say there was any problems with those things. Well, that's why you're struggling. So I think the challenge becomes the person who asked that question and people who have the same situation, listen to that piece of this podcast a couple times, and then you can start to look at your own chemistry panels and say, well, there were no inflammatory markers done. So how do they know if I don't have an inflammatory process? Or, if I do a free T3 to free T4 ratio and I can see there's problems. Oh, my cholesterol is elevated. That means I have a problem. My blood glucose is elevated or my insulin's elevated. That means there's some type of immune inflammatory process. So with the right interpretation, even with a normal thyroid panel, we can start to see problems and that indicators of the inflammation.
Yes. And you have provided a masterclass in labs, which I love. And definitely, you already mentioned, for listener to go back and re-listen to this and take notes. And in my opinion, it's inflammation until proven otherwise, because we're in a ramped up society and so many things are driving up inflammation. And if we're eating any of the garbage on the shelves in the supermarket or at the convenience stores or fast food, we likely have inflammation, and it can be really overwhelming. And I actually had 3 calls today with my labs are normal and they're frustrated, and I'm looking at them, I'm like, normal, huh? Like, because again, looking for H or L, that I get fired up about a lot of things, but that definitely is one of them. If we're scanning it like, oh, everything's normal, or if it's just slightly off, I've seen other practitioners say everything's normal, but they're not really interpreting and looking at it. And I don't think that there's enough understanding of how to interpret, and that's why. Or like, who's running the tests? Because like you already mentioned, so many different tests, and which practitioner is going to be doing all of those different labs, right? Typically not somebody checking thyroid labs that they're going to be checking, fibrinogen or like, and like that. That's not typical. I'll look at tests like that, but if I'm being perfectly honest, I care much more about the individual in front of me, their symptoms, what they've been through in their life, what they've tried, like their triggers, their different things that they have been exposed to in their life, more than a lab value. Because labs could be normal, they could be abnormal, they could be slightly abnormal, and it does not give the whole picture. Versus, like, I mean, what I'm getting from this question also is like, how can I address like looking for inflammation, but also like dealing with inflammation, which is all of the things you talk about in your book and on this podcast, and I talk about on my podcast, and anybody that'll listen. It's the things that drive health, that are going to drive down inflammation. And inflammation is important. Like, I don't want to demonize it. If I fall down, inflammation is going to like protect me. If I'm bleeding, I should have inflammation so I stop bleeding. It's the chronic, low level inflammation that so many people have from being in an overly stressed state, eating a bunch of garbage, not sleeping, no stress management in place. Eric, I can't tell you how many people have told me, like, I feel like less people are telling me this now, but I'm driving it like into people, like from the second I meet them, that they don't have time to breathe. Like, literally, like, do you have 5 minutes, like, to down regulate the sympathetic nervous system, which is going to help lower inflammation and help with every body process and all of your hormones and cells in your body? And they tell me, or at least they've told me, I don't have 5 minutes. I had somebody tell me, I have to get to the next 48 hours and then I can breathe. I said, you're going to hold your breath for 48 hours? And, now looking back, I mean, it's like, he's like a changed man from the things that he did. And they were simple things, right? That if we need to, we need to look at the whole picture, because I feel like we want the answer. So if we find the lab that's out of whack, then we can do something to, like, give me something to address that. Like, okay, my inflammation's high, so what do I do? Take steroids? Well, I guess, yeah, that'll suppress a bunch of stuff in your body. And it's something that I've seen somebody do. Like, people do that all the time, right? Like, oh, if anything, let's just try around the steroids, but that's not going to fix what's driving this, chronic inflammation. But I agree that if somebody really wants to see, like, to get a better picture, it's easy enough. Most people have had, maybe not all of these labs, but some of them done, where they can piece it together and go by the symptoms that they're experiencing. And of course, we all have to be our biggest advocate, and it matters who we see, right? Like, the practitioner that we work with, we should feel that they listen and they're hearing us, and that they're asking the questions like we're asking about their lifestyle and the foods that they eat, because those are the things that are the most impactful, in my opinion.
Yeah. And I think we should kind of just say this so people are aware. Like, especially in functional medicine, we talk about optimal range is like, hey, it should be in this narrow range. And that's not necessarily true. And so lab values fluctuate. And so if you feel good, and this happens a lot too, I'll start working with somebody who's on thyroid medication. I'm like, well, okay, let's talk about how we got here. Like, what was the story? Well, I went in one day, I was feeling great, and they said my TSH was high and my T3 was low, and they put me on medication, right? And I'm like, wait a minute. And this usually happens in a functional or integrated practice, not a traditional practice. And I have a lot of patients that this is the process. The problem is somebody didn't see a TSH in their predetermined optimal range, or a T3 in their predetermined optimal range. And so they thought they were doing the right thing for that person by putting them on thyroid medication, when it might have just been that they had a heavy workout the day before and sweated out a lot of minerals and iodine. And so the TSH had to go up, depending on what they ate, their activity level. Maybe TSH needed to be higher to try and pull more iodine into the system to support it, right? Maybe free T3 was a little bit lower, and free T4 and free T3 were a little bit lower than their optimal range. But is it because they needed more hormone, or is it just because of what they did the day before? Like, if you generally feel good and your value's not in somebody's predetermined optimal range, you may not need thyroid hormone intervention. You may not need any intervention. You just maybe need a couple days. If you're taking your thyroid panel in January and your TSH is elevated and your free T3 is a little bit lower, it's because it's probably January and the values are different. Seasonally, the values change. If you are 66 years old and you go to get a thyroid panel done and your TSH is 2.5 and your T3 is a little bit lower, but you feel and function great, your cholesterol is good, your blood sugar is good, and somebody says, but they're not optimal, we're going to optimize you, that's not good. Because what we can see in the literature is that TSH levels vary depending on the month and the time of the year, depending on age, depending on workout, depending on exercise. So all of this stuff has to be looked at in context. So we don't want to optimize somebody who's already got good function, good physiology, limited symptomatology, and really doesn't show any other values. If that same person came in and their cholesterol levels were normal, their blood sugar levels were normal, we probably don't need to do anything except just say, you know what, you feel good? Yeah, awesome. Let's check these again and see if they change. But I think that is probably a big downside to the functional or integrated practitioners who are trying to optimize when they shouldn't be optimizing. And it puts people on a roller coaster ride of trying to fix thyroid physiology that was never broken to begin with.
Yeah, and you had somebody on your show recently that was talking
Joel
about
Corey, yeah.
And I loved it. Like I actually listened to it twice, and it is something that is very prevalent in the functional medicine space. It was in my training, optimal ranges, and I subscribed to that philosophy for quite some time because I personally didn't feel well. There was lots of other things going on, and like poor mood, like poor thoughts, like negative thoughts, no sleep, like just like check the boxes for all the things I was doing that was not for my best health. And so I was looking for, are you out of range? One thing though that really resonated with me from the show this episode that you did was we should not be prescribing medication from one lab value. Like I personally would say I'll just say it. I don't think that that's best practice. It could be a mistake and it could be a fluke. Like I want to see a trend. I don't want to see one level, and I want to know what's going on. The first thing I always ask is I always say, do not get your labs done if you don't feel good. Like not only can TSH be off, ANA can be high, and then we're thinking they have an autoimmune disease. So it's like, I've seen it where we go down a rabbit hole that we didn't need to go down because there's so many variables that can affect labs. So,
you're talking like if they have an acute illness, like
yeah,
I got a cold, yeah. That happens all the time, right? I just had somebody run their Cyrex lymphocyte map, and I'm
When they're
looking
not
at it,
well.
and they're like, yeah, I was sick, but I just wanted to get it done. I'm like, then I said, I hate to tell you this, and
Got to do it
but
again.
it's it's abnormal. But if you were sick, it should be abnormal, right? We want to catch you in your normal state, and there was challenges with time from the time we talked about doing the test to the time the test was actually done. Was it, kind of the idea of what we were trying to test was lost. But it's a shame. Now but that happens all the time, right?
It
People
does.
get things done when they don't feel well. You and I I'm sure we would agree that, hey, if you have an infection, we really
Nope.
need to run a white blood cell panel. We already know what's going to be. You're probably going to have an anemia of inflammation on your CBC, and you're probably going to have high or low white cell count, depending on what's going on with your overall physiology. And there's going to be some changes in your neutrophils and lymphs. And all that's normal. That's all a normal adaptive response to illness. So we
Yes.
don't want to treat that. But if this is your steady state and your normal state, then that's what we're trying to find. But yeah, I mean, it is a really good point. And I think the point with Joe in that podcast, because I think we had really good conversation on camera, off camera, but I think he was looking at functional medicine like these people that just all overprescribe. And that's really where his issue is, really like, you guys are trying to treat this narrow range. And then having the conversation on the podcast, I think I changed his mind and perception about what some of us are trying to do in functional medicine, is that some of us are not trying to treat a narrow range, right? Or trying to force things into a certain range, which doesn't really make a lot of sense. But what we're trying to use is the labs as a big picture. Like, what's the big picture of what's going on? And from an allopathic perspective, like he would say, from an allopathic perspective, and what he does from a clinical chemist perspective, running tests on healthy people can skew values, because now we're getting values that are all over the place, maybe in people who are healthy who aren't healthy. I understand his point of view, but when I explained to him what we're really trying to do, the people who are really doing functional medicine would look at an outlier value and then question it, say, we don't necessarily need to treat that. Let's recheck it. As you said, that's an abnormal value once. Let's recheck that. Is there anything that correlates with that one abnormal value? No. Great. Let's rerun it. Let's see if it's today, just a one-day thing. Things happen at the lab, values skew, do things in life that change it. But if you're seeing a similar pattern over and over again, then that's when we start to say, hey, that could be an inflammatory pattern. And there's other inflammatory markers here. And that's why sometimes it's beneficial to look at a bigger panel as well, because if you narrow it down, you can't see a pattern. When you bring it back out, you can go, oh, wait a second. Where I thought that wasn't a big deal, but this is off, this is off, this is off, and this is off. So I do have a pattern of problem. And the opposite is true too. If we scan out, run a bigger panel, and we have one value that's out of range, we can say that all these other things are normal. That probably is not something to worry about. But if you only ran a test once, one test all by itself, you're left thinking, that's the test, it's out of range, this is what I need to do. And so I think that's the downside sometimes from an allopathic perspective, is they run such a narrow panel that they can't see the bigger panel, the bigger pattern, and say that is an issue or that isn't an issue. They're just running sometimes a value to say, I'm just care about this one thing and whether I need to do some treatment, and not really take a step back and say, maybe this is okay. And a good example of that is glucose regulation. How many people get a hemoglobin A1C done and go, I'm pre-diabetic? And you look at their fasting blood sugar, it's normal. You look at their fasting insulin, which maybe their doctor didn't run. You go, you're not pre-diabetic. My doctor said I am. My hemoglobin A1C is 5.8. Yeah. Let's go down and look at your red blood cells. You have a low red blood cell population. So you're probably holding on to your red blood cells longer. And that's why your hemoglobin A1C is elevated. It's not because you have a blood glucose regulation issue. If you had that, you'd have problems with your high or low insulin. You'd have high or low blood glucose. The issue is you have a red blood cell issue, and the length of time those red blood cells are hanging around, and you can't make them fast enough. So that's probably the biggest, that is causing the elevated hemoglobin A1C, not a pre-diabetic condition, right? But you wouldn't know that if you didn't run a bigger panel than the hemoglobin A1C and the fasting glucose. It would still just jump to the conclusion you're pre-diabetic. Glucose is still hanging in there, but your hemoglobin A1C is elevated. Yeah, but run the fasting insulin or C-peptide, run the iron panel, run the CBC, and you'll start to see like, oh, this is an anemia of inflammation. I don't have enough red blood cells. These things are hanging out longer, and more glucose is sticking to them. So anyway,
that's such a great point, Eric, that one of the reasons why like doing more of a complete panel versus I'm going to just check this one value. I definitely am not a fan of just checking one thing. Like if we're going to do something, in my opinion, it needs to make sense, and we shouldn't be running them every day, right? And again, I'm looking for a trend. Like what was it, depending on the situation, what was it 3 months ago or 6 months ago or a year ago, whatever it is, and then making sure, am I getting all of the data? Am I getting enough data so that I can appropriately, look at these labs and assess the situation? And if there's a question of prescribing something, I take that. I prescribe drugs, all the time. Maybe not every day, but I prescribe medication. I do a lot with that. But that should not be the go-to move for an outlier, especially if we don't have a full picture, or especially telling somebody their diagnosis then, and then they have that label, and then that's, driving up their stress response and cranking up inflammation in their body. And then it's just another monkey on their back when it may or may not actually be appropriate to like an appropriate diagnosis to begin with.
Yeah. And it's now we're saying this, I'm just thinking about a person I talked to probably yesterday who, they're in the health field, but they just got diagnosed with prediabetes and elevated cholesterol. And they were told, and this is a person who eats healthy, works out all the time, right? She's like, now they want to put me on metformin and statin. I'm like, wait a second. Did anybody look at your thyroid panel? Did you have any inflammatory markers? No. Because she's only really been to an allopathic physician at this point because she's in an allopathic world. But she's like, but I don't want to take a metformin and a statin. I'm like, if you don't want to take it, it's probably, then you have to figure out what's causing it. But if you have glucose resistance, you have an elevated in your hemoglobin A1C is elevated, and you have elevated lipids, you have an inflammatory issue going on. And especially if you're a regular exercise, not over exercise, you eat a healthy whole food based diet. If your glucose is elevated or your hemoglobin A1C is elevated and your lipids are elevated, you got an inflammatory and a tissue hypothyroidism going on. They're not going to fix that. The metformin may lower your glucose, the statin may lower your cholesterol, but now you're going to have a whole host of other issues going on, right? But if they had done a broader panel, right, and in their world maybe they did some glucose and did a lipid panel, but if they would have run some inflammatory markers and a full thyroid panel with it, it would have been a different story, right? You'd be able to, at least you or I would look at that and go, okay, that cholesterol is elevated because of this. This is elevated before this. And realistically, even for that person, before they should go on a statin, realistically, cholesterol and LDL and HDL cholesterol aren't the problem. I mean, you don't have to run a whole VAP panel all you have to do is run ApoA1 and ApoB and look at those, right? And say, okay, yes, my ApoA1 is down, but guess what? If your ApoA1 is down, that means you have a low T3 because T3 drives ApoA1 production, right? if ApoB is elevated, you probably have low T3. So how do we fix it? The statin might take the risk potentially out of it, but it's not going to change the fact that there's a low T3 state that's impacting production. So anyway, let's hit another one before we run out of time.
Okay. How can I explore the possibility of a viral or bacterial infection impacting my thyroid function, particularly if standard tests come back normal?
I'm not sure what the standard tests that they're referring to. Maybe a white blood cell.
I'm not sure either.
Diff, but it's difficult to look. There are labs that'll do viral patterns, bacterial patterns, but it's hard because there isn't a perfect test. I mean, if you know one, you can chime in. But I mean, if I'm looking for systemic drivers of immune dysregulation, I like Cyrex's Array 12, which looks at the most common organisms that trigger immune-related issues. I like the Array 11 that looks at the most common toxins that trigger immune-related issues. But sometimes, if you think there's a systemic infection, and sometimes this is judgment, right? We go, okay, lymph counts up, white counts down. This looks like somebody who has a chronic infection response, and the reason why those lymphocytes might be more elevated for the listener, like the neutrophils, which are a type of white blood cell, they're kind of like the first line of cells that kind of go out there and try and deal with it. The neutrophils and monocytes, kind of first line. To some degree, natural killer cells are always on surveillance doing stuff. But once the neutrophils and the monocytes can kind of get the job done, then the lymphocytes are called out. And the first ones to go out are the T cells. Those are the things that are like blind mercenaries. They're just going out and looking for to bump into problems. And they're helping grab debris and bring it back to these other types of lymphocytes called B lymphocytes that make antibodies. So if in more chronic-y stuff and sometimes in more viral stuff, we'll see the lymphocyte count is a bit higher. But it's not all. You can have chronic bacterial infections as well, and you'll still see the same thing. If the lymphocytes count is up, and especially if the white cell count is down, that may be a really good indication that this is a person that might have a chronic infection going on. And then if I was going to look at testing, there are a bunch of labs. Vibrant, I think, has a panel. There's if you want to be Lyme specific, there's labs that have that. But I might do one of two things. I might run like a Cyrex lab or one of the other panels, depending on what I think it might be. And you might have to run a couple different panels to be real specific. But sometimes if it looks like it, if it sounds like, if you get the feel that there's probably some type of systemic infection and you've got some of these just general lab markers and you see the health history, you might want to just, as a clinician, we might want to just treat as if and say, let's give this a short time frame to see, does this make a change, and see how somebody responds. The other thing I will do sometimes if somebody thinks they might have some type of chronic immune driven process and they're doing everything else right, that's where that lymphocyte map test I like to do sometimes, because it's going to give us, is there an imbalance between in the T cell in the lymphocyte population? Is this a person who's T cell dominant, T1 dominant, Th17 dominant, which are the more pro-inflammatory mechanisms? Do they have low Tregs? Are their antibodies elevated? And we can look at some of those patterns on there. Dr. Rujani's done a really good job. We can look at some of those patterns and say, this is more likely bacterial or viral. And then that may drive us into the next level of testing. Like, okay, this is probably an organism pattern. Let's test organisms. But honestly, sometimes what I'll do, even if I have that, if I have the lymphocyte map test, because we believe that sometimes the immune system can get turned on and has a hard time getting turned down, especially if their T regulatory system is weak. And for the listener, T reg cells, these are T lymphocyte regulatory cells. So when the immune system gets turned on, the T regulatory cells kind of bring it back down again, kind of balance everything back out. And if they have an upregulation of the immune inflammatory system, but the T regs are low, then we could assume that there's an active immune response to something, but it could also be that immune system got turned on and they just couldn't get itself turned back down. So what I'll often do is like a 5-day immune challenge. So I'll provide some products let's say they're Th1 dominant. I'll give them 5 days of something that's going to suppress the Th1 system and raise the Th2 side, or whatever whatever that pattern looks like. And if suppressing or rebalancing, giving them something to rebalance the immune system makes them feel better, then I'm thinking the problem is not there anymore. But the immune system got dysregulated, couldn't get itself reset. Now, remind me to come back to that, and I'll tell you why that might be. But if I gave them something to suppress the Th1 or Th17 dominance and raise the Th2 side of the equation, or support the T regs, and they felt worse, then I'm thinking in my mind, the body doesn't want to restore balance because the threat is still there, and I still need to find the threat. And that's where I may I'll look at the bacteria and viruses, look at array 11, array 12. I'm not as big on the array 10. I like it, but you'd have to really push me hard to do, because I got to make sure they don't have a permeability issue in their gut before I run that test many times. But that can help us, I think, for some people. Now, some people are, they're not as in tune. They're like, I don't know. But if I give them 5 days of Th1, suppress one side, and 5 days of something to boost the Th1 response, or something to suppress the Th1 response, depending on what they experience, I might think there is something currently there, or there's not. And then I focus on if the thing is not there, like the thing that bounces it makes them feel better, then I'm focused on how do I support those T regulatory cells and keep this elevated side of the immune system in check. And that brings me back to that last piece, and then I'll let you jump in. But the T reg piece, for the listener, your GI tract plays a huge role here, because a lot of the T regulatory cells surround the GI tract, and something called your short chain fatty acids in the gut play a huge role in supporting the T regulatory population. So if you've got dysbiosis and you have a diet that doesn't provide the food, which is for the certain bacteria, then you don't have the soluble and insoluble fibers to feed the bacteria that convert those short chain, or those soluble and insoluble fibers, into short chain fatty acids. And then you don't have enough short chain fatty acids to help support the T regulatory system. So now an immune system gets turned on, and it can't get itself turned back off. And that's where I find a lot of people in that state. And that's sometimes why it's beneficial to work with them on their gut physiology before we do a lot of other things, because the health of the gut plays such a big role in both their digestion, their detoxification, the absorption of nutrients, but also immune signaling. So go ahead. I'll let you comment now, because I spoke too much.
No, you didn't. And I loved what you said. And it's so true that, first of all, I'm going to start with the gut unless I have compelling reason not to. Because if we ignore the gut, and 70% of our immune system at least is there, and like you said about permeability issues, I care very much about really figuring out what's going on with that individual. So like with this question with, do I have an infection? Look, I can relate to this with my history of chronic infections. And yes, I'm a huge fan of Cyrex Labs. And I was actually talking about Dr. Vijnani today several times with patients of mine, because I was ordering these tests. And, I run them all the time, and I'm a really big fan of them. I don't always run them because they're not cheap, right? I mean, these tests, and then they lead to more questions. So like I've done almost all of these tests on myself and lots of other people, and then like lots of things are lighting up. So when I see lots of things lighting up, and I feel like we talked about this before, it's really having me question, like, definitely their gut, and like, what's the whole picture? So I first want to know, what exposures have they had in their life? So I do a timeline and matrix on everyone, which I'm sure your listeners by now should know what that is.
Right.
Because I'm really like trying to see patterns, like pattern recognition, trying to figure out, okay, so you had, lots of ear infections as a child, and you had bronchitis, you got the chicken pox, you had Epstein-Barr, and that's typical. That's like most of the people that come to see me, they're not feeling well, or they're not going to come see me.
Right.
And the common denominator is lots of infections. So, I used to feel like I had to always test before trying anything, because that's just the nurse practitioner in me with my conventional training. You don't do anything without blood work, right? You can't, don't stand still, don't make a move until we have your blood work and all the other tests under the sun. And if is anything high or low, and then like, here's your diagnosis and your drugs. But, over time, I've learned and that we can guess that a lot of these things are going on, and there is a lot that can be done. And so I usually, not even usually, every time, it's not my decision, right? Because if it's my life, it's my decision. If it's somebody else's life, we're in a partnership. I'm an educator. That's one of the biggest roles that I consider myself, and letting them know here, like today, I said, these are the 3 tests that I feel like could be really beneficial. We don't have to do any of them. Let me tell you what they are. And talking about, for this individual is also the array 5, like looking for different, autoimmune type things going on based on her signs and symptoms and history and family history. And, letting them know, like, these are the different things that I would maybe be looking at, but we can also like pause this and let's get like a really strong foundation for gut health. Let's really work on sleep, because in stress management, let's really work on all of these foundations if we've already done that, right? So if we already have really solid routines in place, and nutrition is dialed in as best it can be, then maybe I would maybe lean more towards like, we can go and see like specifically what pathogen it is, but likely we all have pathogens. I know some people think everything's parasite, some people think everything's mold, everything's Lyme. I don't think everything is as simple as that, right? But the common part here is there's immune system dysregulation. If that's what's going on, there's a dysregulation. And so in my opinion, and what I've seen work the best, is let's get a game plan to regulate like your immune system, to bring it to balance, so there's not this alert, this threat, right? Our immune system is amazing, right? We are designed to remember, otherwise we would be dead, right? Like if we don't remember things, we come in contact with something and it wipes us out. So if something is dysregulated, and I feel like we're in a society now where it's very common, I think, chronic inflammation, dysregulated immune system. The immune system, we can't like separate it out from the body, but it's for me, it's like, it's without a shadow of a doubt, it's where my most passion in life lies, is with the immune system, because of everything I've been through, and, misdiagnosed or diagnosed with too many things that put me in fear, and everything I've seen with so many people I work with, that there is so much that we can do from like a holistic perspective, even without, specific targeted supplements or different, blasting out biofilms or whatever it is may be warranted. And I do those too. But there's a lot that we can do just without those things. And these are the things that I want to really spread the word about, because they're the things that are going to impact every aspect of our health. Because if we have a chronic underlying infection and then we get COVID, let's say, and then it stirs it up, then we're that's how these things, in my opinion, that's how they operate, right? They're stealthy. That's how they survive for so long, these, viruses and bacteria in the body, that, if they're in there, which they likely are, then what can we do to calm the immune system response, or to crank up the immune system if that's the response that we need? That was a
Yeah,
long-winded way.
yeah. I think and for the listener, I think it's important to know, like, a lot of the organisms don't leave us, right? So
Mhm.
they're either dead, and we can kill off a bunch of organisms. They can be dormant, which means they're kind of like Sleeping Beauty. They're not creating any problem. They're kind of in a dormant, non-functional state. We think they can be latent, which means they're not replicating, but they're functional, and they're potentially releasing toxins and creating problems. And then we can have these acute replicating infections.
Mhm.
And probably the easy way to think about this is like you have like a herpes virus never goes away. It's either active and replicating, or it's dormant, and the different stressors we put our bodies through trigger some cell stress, some cell damage, and that can reactivate the virus temporarily. And then it takes the immune system about 7 to 10 days to get it back under control, patch up the damage, and the virus goes back into dormancy. So I think you're right. Like when you're talking about um, some of these tests and maybe doing all these other things first, because even if we do the tests, and you see this a lot, like when people say, well, I've been through 5 gut protocols and I still have gut issues. Okay, well, then the gut isn't the primary issue, right? We need to figure out what else is there. How many more gut protocols are you going to do if you don't address the root issue, right? So, okay, is the 7th one going to be better? Like, probably not, right? But if you have chronic infections, it's because the immune system is compromised. It's because there's resources available. It's because there's chaos in the system. So, like what Tara is trying to express is that one of the best things we can do, and it sounds like a broken record, but if we just address these foundational things, healthy diet, healthy lifestyle, healthy habits, we're putting the body in a better situation to be able to fight the good fight and deal with these things. More often than not, we're trying to kill an organism when the terrain that the organism lives in is still conducive for that the organism. So we don't kill it all. We knock it down. It gets a little stronger, and then it grows back. And we're
Mhm.
surprised that it comes back 2 months later, 3 months later. And we're like, it's back again. Of course it is, because the environment hasn't changed at all. What have you done to change your diet, your lifestyle, whatever? Um, those are the things that are going to make probably the long-term change. The supplementation strategy, antimicrobial strategies, they're good short-term strategies, but if the terrain doesn't change, it doesn't get any better. The other thing you said, you were talking about Array 5, and for the listeners, Cyrex is Array 5. It's what they call their multiple autoimmunity panel, and it looks at, I think, maybe 26 or so different tissues that we can develop immune damage of, or we can have what we call an immune-driven condition. And it's a good test, and I'm sure I'd be interesting how you think about this, but I love the test from a nerdy, sciencey standpoint, right?
Yes.
But when people who are knowledgeable about the test and know about the test and ask me in the beginning, like, I heard about this test, can we run it? And I always, it's not an inexpensive test. And I'm like, listen, I love the test. I mean, but the problem is this. I already know you have an immune or immune-driven conditions. So knowing you have 5 doesn't change what I think we need to do, or knowing you have 1 doesn't change what I think we need to do. We need to calm and restore balance to the immune system. So the bigger question is, how is it going to impact you? If you know you have 1 autoimmune condition, which you already know, is that going to be different than if I tell you on Thursday that you have 12 potential immune-driven disorders? Yeah. Okay. What's the experience going to be? I'll probably be stressed out. Right. So why would we want to do that? And the antibodies aren't indicative of damage. We call them predictive antibodies, meaning that those tissues are potentially being damaged. I think sometimes we think that the antibodies are causing the damage when we do those tests, and therefore we see antibodies, therefore those antibodies are gobbling away my tissue. And I don't think that that's the mechanism of action in most cases. I think it's the inflammation, maybe the T lymphocytes targeting the tissue because they think there's something wrong with the tissue. There's inflammation that's damaging. There's oxidative stress that's doing it. You're taking maybe copious amounts of vitamin D that's causing too much calcium to go into cells and creating apoptosis and damage. And what's happening is there's debris, and the immune cells, especially those T cells, are picking up that debris and presenting it to the B cells, and they're producing antibodies. But they're predictive. And I think that the antibodies are oftentimes in vivo more the cleanup than they are the damaging. And this is argued all the time, right? Did the antibodies cause it? Did they not cause it? I think it's probably more the inflammatory mechanisms, the oxidative stress, maybe the infiltrating lymphocytes, like in the thyroid gland, that create the damage. I don't think the antibodies are doing as much of the damage based on what I read. But it's important because it really doesn't make a difference if you have one autoimmune disorder or 3 autoimmune disorders. The issue is not which tissue it's showing up as or presenting as the tissue that's being damaged now. That's important in an allopathic model when we're trying to treat the skin, or we're trying to replace a thyroid hormone, or we have to give you insulin. It's important to know which tissue's under attack, but it doesn't really change from a functional medicine perspective our strategy, which is, hey, the immune system for some reason is creating some inflammatory mechanisms. We need to figure out the root issues. And it sounds, I guess you might think like, well, then why do I need it all? I think it's nice to have an idea of which tissues could potentially be damaged. The people I typically would run that test on, if I was going to run it, are many times the person who's more sciencey and just wants to know, and I know they're not going to freak out, or the person who's going, you know what, I don't really want to change my diet or lifestyle. I don't think it's that big of a deal. Then I think it's a really good test to do. And it's a good investment in their money, and say, look, we're going to do this test, and we'll see what shows up. It's not a long-term story. Like if something's not positive now, it doesn't mean it won't be positive later. But we just want to see what potential tissues are being damaged. And this test is going to tell us. And so when that person who didn't want to change their diet, they don't want to change their lifestyle, they don't want to change their behaviors, and you get that test back and you go, okay, look, you've got antibodies to your thyroid, you got antibodies to your cartilage, you got antibodies to your liver, you got antibodies to your cerebellum, you got antibodies to this. Well, what does that mean? That means these are likely disorders that you're going to have in time if you don't change something. That's the kick in the ass that sometimes some people need to get sometimes. But I've done that test on people too early, like especially early in my career when the test first came out, because I thought it was so neat. And then I had people like losing their stuff because they're like, I'm doomed. Like, they were too early in the process. I didn't get them through the process far enough along before I ran that test. And so automatically they think they have to get on medication to suppress their immune system. Yeah. And I didn't get enough time to educate them. So I think it's an awesome test. But do you use it along the same way with that, or do you use it from a different perspective?
That's actually a very similar perspective. It's not how I started. So the first person I ran it on was myself. And I was already in a very negative mindset. And interestingly, I think I told you this on the first show that we did, that they told me I had lymphoma and I actually had Hashimoto's. So my thyroid, when they removed it, was just like all lymphocytes. Like it was so invaded. That's why it was so big and I couldn't swallow solid food. But so I was on a mission to find out all the other problems I probably have, because I was told I was hopeless with autoimmunity, and so many things lit up on that test. And I was in a very, very dark place for quite some time. When I think about those days, I'm not even really sure how I got through it, because it sent me down a rabbit hole of thousands of dollars worth of tests and speaking to immunologists everywhere. And I learned a lot, and it changed everything about the way that I practice medicine. And it changed everything with the way that I look at the immune system, it started where I was terrified, like, oh my goodness, okay, I'm going to my liver, to my myelin, like like a huge list, like, everything's red. And not everything, but so many things were red. And then I'm doing the pathogen test. So many things are red. The chemical exposure, so many things are red. And I'm like, what am I not attacking? I'm broken. My immune system's broken. And then something clicked for me, and it literally changed my life, because I came to the realization my immune system is not broken. It's awesome. How awesome is my immune system that it works that well? Do I want to suppress my immune system? It believes something is wrong. And well, no wonder. I was sleeping 4 hours a night. I didn't know what stress management was. I was eating in a constant state of I had that feeling inside where I literally felt like I was going to explode. I think I was crying all the time. I had significant anxiety, and I had anxiety for most of my life. And I didn't understand that was a symptom of my real poor lifestyle and mindset. And so it changed everything for the way that I look at this test. So now, the one I ordered today, I said, this is not the test to run if you think it's going to give you the answers and now we know what to do, because it is going to raise more questions. So if we're making antibodies to tissue, it doesn't mean that we have destruction to the tissue. I agree. I believe this is before the storm for most situations. And so I like the test for that, especially for somebody with symptoms like mystery symptoms, or somebody that, just feels off, but they're not getting anywhere and they want to know, and they have the money to spend on the test because it's expensive. And they know that the results do not, if something comes back, it can be alarming. But if it's 1 or if it's 20, I agree. It doesn't really, I don't want to say it doesn't really matter. It matters, right? But it doesn't mean that all of our different body tissue is going to be destroyed. It means it's coming from the same place. The immune system believes there's an alarm. And so we can suppress the immune system, which is the conventional medicine model. Like I was told is, hey, don't worry about it, Tara. As soon as it gets really bad, we'll give you those immunosuppressive drugs. You got anything else for me? No. I'm like, well, I'm going to find another route. And I did. And I could barely walk, and now I run again. So I know that it works. But it took, I was the person, okay? I was the person that wouldn't change my lifestyle. So if I was seeing somebody like you, and I'd be saying it has nothing to do with my garbage diet and all the sugar and that I'm not sleeping, and you run the test and it's like, open your eyes, Tara. There's a reason, and was, mold was a factor, Lyme, but going after those, if my gut's a mess, if my stress management is a mess, I think it's wasting money, and we could be doing a protocol that will fail because the body's not prepared for it. The body needs to be prepared, but as a closing remark, because I can literally talk about this all day, every day, is that if there's an immune system dysregulation, the most important part is to remember that you're not broken, that you, meaning whoever has the immune system dysregulation, is the keystone player with getting it regulated. And it all starts here and here. These are the most important parts. These are the things that changed my life. Okay. Not, selenium or, B complex or, all the different biofilm busters. Those things, they can be helpful, but these things are what actually changed everything about my life, my health, and my immune system.
Yeah. And I agree with that part. So yeah, I think it's a good place to end, because we got through an hour and a half, maybe 4 or 5 questions. But again, I think we get in depth on some of these things, and I think we get into some detail that can help some people out. But for the listeners, I think, share these episodes. if you have questions, obviously submit them. I've got a bunch that at some point we'll cover some of those as well. I try to do some of those on my Thyroid Thursdays. I'll probably do some short episodes of the podcast too to get some of those in. But at the end of the day, really what we're trying to do in functional medicine is clean up as much as possible these things that I talk about in my book as the fitness factors, but essentially they're the key components of what drives health, or the key components that drive illness. And most of them are all come down to choices. And it sounds too simplistic, but we have a choice to eat healthier or to eat unhealthy. We have a choice to drink alcohol or not drink alcohol. We have a choice to exercise or to not exercise. We have a choice to, share love or share anger, right? We have choices. And I don't think many times we don't even realize that we're making bad choices. It's just what we do. It's Tuesday. This is what I do on every Tuesday, right? This is what I do. But it is really about these key things. And there's enough science and there's enough clinical experience where we can see that people who change their habits, their diet, their behaviors, their mindset, their focus, their attention, their relationships, can go from chronic illness to a pretty high state of health and well-being, with or without supplementation, right? So
yes,
it is. So it's everything there's a level of doable and manageable. That doesn't mean you can just will yourself, like I'm dying of cancer, I'll just think positively and it won't be there. I mean, that you need to have the positive positive mindset, but we don't know that the level of degeneration or deterioration or allostatic damage that's been done already. But you'll never get healthy if you don't have these foundational principles, because there's not enough supplements to take that can get you there if you don't address these foundational concepts. So once again, Tara, thanks so much for coming on the podcast. I know we'll probably, if you'll do it, we'll do another one. So we'll get all these questions answered, but I enjoy doing these each month. So I appreciate you coming on. Some of the questions that people ask are things that sometimes I wouldn't necessarily think of, because I'm thinking up here and somebody's asking like a question here. And I'm like, I wouldn't be the thing. I would just think that somebody would have that question because I'm just thinking on a different level. But I think we're doing exactly what the Thyroid Answers podcast is all about, is giving answers to some of the questions people need to get answers to. So have a great night. Have a great day.
Thanks so much, Eric.
And I look forward to talking to you again soon. And we're going to have you back on the podcast shortly. And I think probably this episode will come out before the next one does, where we're going to talk about something interesting that you're doing to help share the message of health and healing with some of the people. So we'll have you back on for that specific topic.
Awesome.
Okay?
Thanks so much, Eric.
You got it. Have a great day. Okay.
You too.